Wendy is going to be talking about Health 811 and about access to telehealth and healthcare in Ontario.
Thanks. I'm so happy to be here. Thank you so much for inviting me. As Alex mentioned, my name is Alex. My name is Wency, sorry. It's good off to a good start. Okay, my name is Wency, and I'm a reporter for the local magazine. And just to start off, let me tell you a little bit about local, and I can tell you a little bit about myself as well. And then I can walk you through my reporting on Health 811 and what I found. So the local, like Alex said, is an independent online magazine. Our mandate is to cover urban health and social issues. And we really focus on issues, populations, and neighborhoods that are really undercovered, not paid the attention they deserve in the mainstream media. And our focus is on the GTA. The locals now about a little over 6 years old, and we're funded by foundations like big foundations like the United Way and the Wellesley Institute, and also by readers. And we're one of the few Canadian news outlets that is a registered charity. So that means we're free to read. There's no paywall, and because we're a nonprofit, we really we really see our journalism as a public service. So I joined the local about 2.5 years ago. Before that, I was a health reporter for the Globe and Mail, and the local really got onto my radar during the early days of the pandemic, and it was the first news publication that I saw that was really spelling out the inequities of how the pandemic was playing out across the city. So, from where I stood, and we were at the Globe and Mail kind of trying to cover the pandemic from a national perspective, what I was seeing at the local, I saw some really incredible in-depth coverage, and I knew that was a place that I wanted to be. So at the local, we have 4 themed issues per year and several other, in between, we also have other pieces. But, our themed issues can be things like, we had an issue about urban wildlife. We had one about post-secondary education. We have themed issues about one specific neighborhood. Like we did one on the Finch West issue before the Finch West launch of the Finch West LRT. So this winter, we decided to do a issue all about healthcare, and the name of the issue was the cost of care. So I had this idea of inquiring about wait times for Health 811 because I actually personally had a really long and agonizing, excruciating experience with Health 811. So Health 811, for those of you who don't know, it's actually a wonderful idea. It's one one of the main components of Health 811 is this hotline. It's a free confidential helpline or online chat. And you get to, you can call it any time of day and get to speak with a registered nurse and get their advice, their health advice on whatever is ailing you for a non-emergency health issues. In its former life, Health 811 was called Telehealth Ontario. And in the spring of 2022, telehealth, without a lot of fanfare, not a lot of attention was paid to it, was changed to Health 811. And I'll get to that change in just a minute. So when telehealth was a thing, 13 years ago, I was a new parent, had this, had a newborn baby, and telehealth was actually a godsend for me. I was encountering baby's first ear infection, baby's first fever, baby's first midstream rash, and thankfully we had a family doctor. But 3 a.m. you have a crying baby and you don't know whether to take them to the emergency or not. Telehealth was great. You can call up a nurse, talk to them right away. Fast forward to 2025, I think it was around the summer of 2025. really late one evening, I had some like irritation in my eye. And I thought, maybe I had like got a splash of chemical in it or something like that. And that irritation really quickly turned into like this horrible burning pain. And it was like this horrible toe curling burning sensation. And so that kind of freaked me out. I was like, am I going to lose my eye? I'm not going to die. So it's not like an emergency. But it was pretty late at night, I tried everything, like flushing my eye out and whatever. And finally I called this hotline. Well, the answer, like the it was like a digital operator, and said something to the effect of like, we're experiencing higher than normal volumes, and you can either wait on hold or put in your telephone number. So I put in my telephone number, and eventually I fell asleep on the couch. 6 hours later, I got a call back from the helpline saying, "Okay, do you want to talk to a nurse?" And by that time, the burning sensation had mysteriously gone away. Still don't know what happened to it, but I was like, "This can't be right." Like 6 hours. Um, and so when we decided to do this healthcare issue, I'm like, "Okay, I want to find out what is going on with this system." Um, so I pretty quickly found out right off the bat that this change happened in April 2022. And so with this change, a few things had occurred. First, okay, telehealth was changed to Health 81. Precursor was called Health Connect Ontario, but eventually Health 811. And it wasn't just a name change, but it was an expansion of um, what the service would be. So instead of just a toll-free helpline, it was now you could do a chat and connect to a nurse. There is also a library, an online library of medical resources, a whole suite of tools, and the Ministry of Health kind of built it as this like digital front door to the healthcare system. So any sort of health issues you might have, you go to Health 811, and the idea is that it sort of triages you through the healthcare system. The second thing that happened is like the oversight of Health 811 switched. So telehealth used to be under the Ministry of Health. Now it was put under Ontario Health, which is sort of the crown agency that's responsible for administering like all of our healthcare services, so hospitals, home care, that kind of thing, that is under the umbrella of Ontario Health. The third thing that happened was it switched from something that was carried out by a company called Sykes Assistance Services to Orion Health, which was it was a consortium led by Orion Health. So there's the kind of the three big changes. Now here's the tricky part. None of these responsible parties, not Ministry of Health, not the Ontario Health, not Orion Health, would answer any of my questions. So I fired off a Freedom of Information request to the Ministry of Health, and I asked them for the wait time data for Health 811. And I can show you what they sent. So you can see here that they gave me the month by month inbound calls, inbound chats, and the average times. And what was kind of bonkers was like, these are in seconds. So keep in mind, they're average. The wait times were as high for those P2, which is like priority 2, like less urgent calls, was around 11 hours, and this is average. So I, went back to the Ministry of Health, went back to Ontario Health, went back to Orion Health, and was like, what's going on here? Got crickets. So the next thing I did was file another Freedom of Information request, and this time I looked for. Oops. So this time I've requested what things look like prior to the switch. Like, so things like, the wait times for telehealth. And you'll probably see that the telehealth, these are in seconds. So people were being able to speak to a nurse within seconds. So you went from seconds, a wait time of seconds, to as high as 11 hours on average. That was pretty stark. So, um, the things that I was able to kind of pull together through this data collection was okay. One, Ontario Health and and the ministry and they were kind of billing Health 811 as like sorry, they were saying that about 95% of calls and requests were responded to within 60 seconds. And I could clearly see from the data that I had received that maybe they were getting the digital like answer within 60 seconds, but they certainly weren't talking to a nurse within 60 seconds. And the second thing that the ministry, Ontario Health and Orion Health were talking about was like how I believe it was around, there up to 80% of the calls that they've received were being redirected away from our overwhelmed emergency departments and being redirected to the proper channels or whatever they might be. But what I could see from the data that I received was you can see here on the dispositions, actually, it's true that only, like less than 10%, around 10% were told to go to the emergency or call 911. But there's like a whole slew of calls that were told to go to immediate urgent care, contact medical care within 24 hours, go to urgent care. And if you're one of those, if you're one of the unfortunate 2.5 million Ontarians who don't have a family physician, what does that look like? You're kind of probably getting back to the emergency room again, right? So, those were like kind of the biggest findings from this data, this data that I received. There were a lot of questions, unfortunately, that I didn't get the answer to. And I'll leave you like with a few things though. One is obviously that Health 811 is not working as promised, and it could be great. But if this is what the digital front door looks like to our healthcare system, then that door is pretty jammed. The second thing that I want to leave you with is the lack of transparency. So if the lack of transparency around Health 811, which is, I'd argue, a pretty vital slice of public infrastructure, if that doesn't trouble you, it should. So for us as journalists, journalists can get a bad reputation these days, and for good reason. But we're supposed to be proxies for the public, and we're meant to ask questions of authorities and on your behalf. And the way the game works is you're supposed to answer. The fact that neither the Ministry of Health, the Ontario Health, nor the company that has the contract to Health 811 would not answer questions is pretty troubling. So I'll leave you with that.
Okay, thank you so much for that presentation. It's really, really interesting. I'm sure we're going to have some good questions.
I had two. The first one is just if you can clarify the change. I remember when Telehealth Ontario changed to Health Connect Ontario, but telehealth, which had the much shorter wait times, and I experienced those personally at the time. I remember that. I haven't called Health 811. Were those nurses employed directly by the Ministry of Health, or was there an intermediate like Orion Health then too?
Yeah, no, that's right. So telehealth was originally Sykes, and Sykes was the company that was hiring the nurses. Yeah.
And I presume you would have shown us if you'd requested it, but I'm curious to know how many nurses are employed staffing this line, because that seems like perhaps the obvious reason is
Yeah,
staffing.
no, that's a great question, and it's one that is one of the questions that went unanswered, unfortunately. But that's right. Yeah, that's right.
When you submitted the FOI, was the government not willing to give you more up-to-date data? Because I noticed that the data was from 2022. We're
Oh,
in
yeah, sorry.
2026.
So it goes all the way up to.
Oh, okay.
Sorry. Yeah, I think I got it up to. Let me see. Sorry, I'll have to. I'll get back to you on it, but it does go up to 2025 at some point. Yeah. Oh, I can show you actually. Here, let me see. Yeah, sure.
Yeah, so the question, sorry, can you repeat the question into the mic? Just a reminder that for the online participants.
Okay. So knowing that you do have data from 2022 to 2025, I was just wondering if the wait times have gone worse over the years.
In short, what was happening was the wait times would go down during the summer months, which is not surprising actually, because especially if you think of it in terms of the infectious diseases, like winter months are the worst for cold and flu. They're usually the worst for like emergency wait times and everything. So it kind of stands to reason that during the summer there are fewer. So the latest data, it went to the summer of 2025. And so, yeah, you can see the peaks. There's not, like, aside from the seasonal peaks, there wasn't really any sort of patterns that we could just see, like, from the data itself. So it's likely, to your point, it has probably something to do with the staffing levels.
Yes. Hi. Two questions. First part is how long did the Freedom of Information request take? And the second part is, do you have any information about what was the reason for the changes in service based on what you've been able to find out? Thank you.
Oh, thanks for the question. Yeah, so the Freedom of Information request, this one didn't take too long. Sometimes Freedom of Information requests can take like months or even years to actually access the information. Because we're asking for just straight up data, like, yeah, I've found that anytime you ask for just spreadsheets, they usually can get it to you like within probably about 2 months or so. Then the other question about, sorry, can you repeat the second question?
Sorry, my second question was, do you have any information or any knowledge as to what was it that caused the change in service?
Oh, right. Okay. Yeah, that's great. Yeah, thanks. So officially, I was not able to get the answers for that. Unofficially, so we know that part of the reason was probably COVID. During the peak, I'm sure if you were in Toronto at the time, you might remember that at the peak of the first wave of COVID, telehealth was just absolutely bombarded with calls, and it was also bombarded when the first round of vaccines became available. I think probably that was enough to kind of push the government to want to make some changes. Interestingly, though, from the data, we could see that even at the worst of like these COVID waves, telehealth was getting the response time for like getting a call back from telehealth was sometimes up to 20 hours or something. But if you stayed on the line, it was actually still probably faster than 11 hours or whatever it would be for a telehealth or a health 811 to call you back. So yeah, for one, back to your question though, one probably COVID. The second was they were wanting to expand telehealth. So expand it from beyond just a call helpline to sort of more of a suite of like digital tools that you could use.
Yes. One, love this. I do very similar work, and my question's around FOIs as well, because I live in FOI land, and something I've experienced with Ontario data specifically is the inconsistency of the data when you try to compare year over year. Changing ministry names, consolidating program names, reclassifying programs by types. And I'm wondering if that's also your experience. And if so, do you think it's deliberate muddying, incompetence, or both?
That is a great question, and yes, I have absolutely experienced that. One of the things that you would find if you go to the story to on telehealth and Health 811 is that you can't do like a direct comparison because you have like Health 811 was breaking it up between lower priority calls and higher priority calls, and telehealth just had it all in one chunk. So you can't say like yeah, it's like it's average as opposed to like anyway. It was a little bit like hard to compare directly. But absolutely, when it in terms of calling programs different names, I don't know that it's necessarily purposeful obfuscation. I think with each government, they want to try it. Like the imperative is to try to create something new, and so in creating something new, like nobody wants to just improve the old system. I think is probably really what happens. Yeah, I don't think it's necessarily intentional. It's just bureaucracy at it, at doing what it does.
Did you get any feedback or anything from why the FOI requests were not being responded to, or at least the stuff that wasn't responded to?
Oh yeah, why our questions were not being responded to? That no. So I felt like from my experience, I've been in journalism long enough to recall the days when a journalist could call up a ministry and ask for an interview with the minister themselves. Over time, and I've like certain levels of government are worse than others. Without, I would have to say that the provincial government is actually kind of the hardest to get answers from. But over time, it's kind of devolved into like you can wait and get an interview at some point down the line to just a canned statement from the ministry to now what is systematically happening with the provincial government is they're just not answering emails at all, not even responding. So that's kind of the thing that we're running up against. And this is not just with the health ministry, but other ministries that we're trying to report on. So.
Yeah, so you mentioned it's hard to get a call from the FOI office. I imagine I'm also experiencing that. I'm also just curious in more of a gossipy way that people might find interesting. Did you get any deposit checks shredded in the late December, January? Because I know a bunch of journalists had their FOI checks accidentally shredded. Yeah.
Gosh, okay, no, I haven't had that experience. And just to clarify, it's not with the FOI office. I've with the FOI offices, they've been fine. I've just been asking for databases, really, for the most part, and the responses have been fine. It's just it's talking to the ministry itself, like
yeah. Sorry, I agree. I love the FOI office people.